So, good day everyone. Again, my name is Antoinette Pedad, AMDNA second year college student. So now I'm going to demonstrate the wound care or wet to dry dressing. So for the first procedure is to review the medical forms for dressing change procedure, explain procedure to the client and instruct client not to touch the wound area or sterile supply. So introduce yourself and ask the name of the patient. So ma'am, good morning again ma'am. Ako day si Antoinette Pedada, imuhang nursing assistant karong adlaw. So mangutan na lang ko sa imong pangalan ma'am. So good morning Miss Pedad. Karong adlaw ang kon sa doctor is to change your dressing or wound care. Okay lang ba ninyo ma'am? Okay, salamat. And after that, close doors or cubicle curtains and the windows. Next is place client comfortably and draped with bath blanket to expose only wound side. So, after that, place the waste receptacle within reach of work area. Next is apply face mask and protective eyewear if required and wash hands thoroughly. So wash hands. So after that, washing your hands dry, then put on a clean disposable gloves and remove the tape, the drainage and drains. So actually this is the clean gloves. So after putting, next procedure is to remove the tape. Remove the tape. So pull parallel from skin, then pull toward dressing and remove the remaining adhesive from skin. So with the hand glove, carefully remove the dressing gauze dressing one layer at a time, taking care not to dislodge drains or tubes and keep soiled undersurface away from the client side. So if the dressing sticks on wet to dry dressing, do not moisten it. Instead, gently free dressing and alert clients of potential discomfort. So, like this. So, observe the character, the amount of drainage on dressing, and the appearance of wound. So, Observe that. Then dispose the soil dressing in a waste receptacle. Then remove the gloves by pulling them inside out. Dispose of in a waste receptacle. This. So open a sterile dressing tray or wrap sterile supplies and put on a bedside table. So after that, then apply dressing. In apply dressing, we have a dry dressing. So carefully, this is a sterile, so we're gonna touch the end of the sterile like this, like that, and then like this. So carefully, you're gonna touch the end of this tray because this is a 1 centimeter of a non-sterile, so you can touch it. So carefully get that thing on this sterile. Then put it on the in the side. Then get the forceps. So after that, open the bottle of solution. So this is the normal saline. So poured it into a sterile basin. Okay. Next is apply sterile gloves. So do not touch the contaminated area of the body, only touch the sterile side. So now we're gonna pick the forceps, then through it this not this thing. Apply sterile gloves. Next is to inspect the wound for appearance, the drainage, and integrity. So avoid contact with contaminated material. So cleanse the wound with solution. So use a separate swab for each cleansing stroke. So this is sterile and this my thing is sterile in here. So this is the sterile balls. I'm gonna open. Then get my picking forceps. So I'm gonna put a lot in here. So clean the from least contaminated area to most contaminated wound area. Like this. So one stroke only, then put in a waste receptacle or in the basin, kidney basin. And after that, use a dry sterile gauze for sterile gauze in the same manner as in steps 16.4a to dry wound. So this is the dry the wound, then dispose again. So apply the dry dressing sterile into to incision or wound. So apply loose gauze, a woman gauze as a contact layer, and cut the 4 by 4 gauze flat to fit around drains if present. Pre-cut gauze is also available. Then after that, apply the second gauze. Then lastly, apply the thicker woven pad. Then remove these sterile gloves and dispose it into a waste receptacle. So, and right now we're going to demonstrate the way wet dry dressing. So, for the first procedure is to pour prescribed solution or a solution into a sterile basin. a sterile basin. Then add the fine mesh gauze. This is the normal saline. So add 2. So I'm gonna add 2. That. Then next is apply sterile gloves. Then inspect the wound for appearance, the character of the drainage, then the type of the suture and drains. Then cleanse the wound with prescribed antiseptic solution or normal saline, and then clean the wound from the least to most contaminated area. So remove this. So inspect. Okay. Then put in a waste receptacle. Next, after inspecting, clean the apply the moist fine mesh gauze in a single layer, on a single layer directly onto wound surface. So if the wound is deep, gently free pack into wound until all the wound surface are in contact with moist gauze. So now like this. Spread the gauze. Spread wide the gauze. Then, using my Perkin forceps, I'm gonna put this here. So like this. Then apply dry sterile 4x4 gauze into wet gauze. So apply tape over dressing. I'm gonna pull this, not yet done. So Then after that, after taping, so remove your gloves and dispose in a waste receptacle, and remove the mask or the eyewear and dispose in a waste receptacle. Then next is assess the client in a comfortable position, and lastly, document everything from the drainage and the result. Lastly, dispose the supplies and wash hands thoroughly. And don't forget, do aftercare. So that's all. Thank you.